All right. I want to welcome everybody here tonight, August 17th, 2021, official time 6 o'clock. I'd like to call this meeting to order. This time I'll need approval of the agenda.
Motion to approve the agenda, Chairman.
Second.
Second, all in favor, aye?
Aye.
Ayes have it. Thank you very much. Mr. Woodward can't be with us tonight, so Ms. Produce is going to open it up, the meeting for us.
Let us pray. Father God, thank you for this day that we're able to come together, as a community. Thank you for your protection. Thank you for the health of those in this room, that they're able to be here today, that we have the chance to discuss the county's business, that you give us guidance, that you give us wisdom above all to make the best decisions, to always honor and glorify your name in our actions and in the discussions and decisions that we make as a community, and just give this board your wisdom as they process decisions that come before them. We ask that you always place your hand of protection on our members of men and women of our armed services, of our law enforcement, and of our first responders, and just bless this county, bless this country. In your name we pray. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Ms. Brody. Very good. All right, we'll move on tonight. Let's see, board appointments, appoint PFA board members with terms. Mr. Wood, did you come up with
Still working on
that?
that.
Did
Thank
we
you.
have something else on 3? Or just we're waiting on?
That's the last one we're waiting on, and then the board will need to decide which members get a 3-year term and a 2-year term.
All right, we're going to do that after Commissioner Wood gets this appointment.
I think it's fine to wait for
Okay, all right, we'll move on. Next, we have consent agenda and approval for the minutes. We got first Tuesday, August 3rd, also executive session, August 3rd. The board had opportunity to review the minutes, and if so, I need a motion to approve.
So moved.
Second.
Second, all in favor, aye?
Aye.
Ayes have it. Thank you. Like the haircut. All right, visitors, Health Department, ARPA, CDBG. Mr. Hutchinson.
Good evening, folks. How are y'all tonight? A few months ago, we came to you, I'm going to take this off right now. We came to you to talk to you about the health department facility. The Board of Health and our staff have been discussing it now for the last couple of years about how we can improve that facility and how to make it a little bit more user-friendly and more efficient for all of the services that our staff provides there on behalf of Jones County residents. I've given you a handout, or Jason has there, of what we evaluate or have evaluated to see the somewhat of the needs are. You got there a picture of the existing facility. You know it's located behind the library, which was just recently redone, and it's next door to the United Methodist Church, there behind the courthouse. It was built in 1990, approximately 6,400 square feet on 1.34 acres. Has about 60 parking spaces, 4 exam rooms, 9 office spaces, 4 storage rooms. It did have a dental office that was converted into a storage room, and has been used for storage for some time. Has a very small conference room, so small that we can't use it. It's just not big enough to do any training in, and the Board of Health has to meet over at the annex over near the courthouse. Then a reception and intake area. A little bit about the services that your health department provides for those of you that may be unfamiliar with that. And most recently, of course, you're familiar with all of the COVID testing and COVID-19 vaccines that were administered by your staff, and they've done an amazing job at that facility, and we appreciate them and all of their hard work. They did have to work out in the elements quite a bit during the cold. We tried to provide them with space heaters out there. Then we had problems with all the rain this year, and then the heat. And so of course, we're doing the drive-through clinic, and the elements made it very difficult sometimes for them to be able to maintain the level of service that they were needing to provide to the patients or to the clients that were coming through. However, they excelled and moved through graciously, and thanks to some COVID-19 funding that we received via the CARES Act, we were able to supply them with a tent for the front of the building so that they could do 2 lanes of traffic through there at a time. However, that has since run out. And we really, for the foreseeable future, especially now with the uptick in the number of cases and the testing requirement that we have in front of us, as you probably were aware from the governor's press conference yesterday, we're going to see quite a few more of those visits happening, and we hope, although we hope we don't have to go back to the drive-throughs, we probably will before the fall, or before winter anyway. As flu season comes, so will probably an uptick in the number of cases, unless the population becomes more vaccinated. So as you see there, I've given you a lot of numbers. One of the interesting things that came out of the University of Wisconsin Health Rankings Report, which is done every year annually for health counties in Georgia, counties across the country, Jones County ranked 36 in the state of Georgia out of 159 counties in overall health outcomes, which measures, poor health, such as diabetes, high blood pressure, hypertension, cancers, that kind of thing. And then it also measures what are called factors which contribute to poor health or to good health. And actually Jones County came in at number 26 out of 159 counties. So those are excellent numbers for Jones County. Jones County has, in the last I've been here 7 years, practically every year has just kept moving up and in the way of better and more healthy outcomes and factors which contribute to improved health rankings. A lot of things go into that, which are physical activity, availability of good food to neighborhoods, transportation, probably your access to good medical care, and other issues. So I would say that we would want to keep Jones County moving in that direction. And as a result, we feel strongly that an improved facility, an expanded facility, or a new facility would certainly help in that regard. You can see there on the 2 columns I've presented to you the numbers of services that have been provided. You can see a distinct difference between 2020 and 2021 on overall numbers. When you look at the total numbers of 9,119 visits in 2021 compared to 2020 of 5,376, over 4,000 of those visits in 2021 were COVID-19 related. So substantially, we saw a decline in a number of patients that we were able to see in your health department for things such as women's health, STDs, communicable diseases, TB test, maternal and child health, as well as WIC nutrition services. primary reason is, as the governor said yesterday, we just didn't have the staff. So, as a result, our staff was doing nothing but COVID-19 response and doing very little, we had very little time to do anything else, or really the facility to do so. The waiting room was not equipped to see patients, and it was difficult to see people who especially were sick. So some of our clinics have even gone to seeing patients who are sick patients outside in the parking lot and then they have to pass a COVID test before they're allowed into an exam room. It's not the case in Jones County yet, but that's just an example of where we're headed in this pandemic as well as probably future pandemics. You can see also there that there was a decline in the number of dollars that were generated in your health department. And of course, that is attributable to the fact that we were unable to provide a lot of our Medicaid and private insurance and Medicare billable services, because most of what we were doing were services that were free to the public in the way of COVID-19 response. To talk about the existing facility, the disadvantages that our staff sees where they are right now is the biggest problem is we have very limited visibility, and the location is very difficult for our clients to find. We consistently get people who come in saying it took us a while to find out where you were. And the city allowed us recently to put up some signage next to the library over there. That's helped to some degree. But folks that are coming through the main street in town have no idea where the health department is. The exam rooms there are crowded. They're very small. They're tight with the cabinetry that's there. With women's health exam tables, they're quite large, and they have to be, and in order to accommodate patients. And so they take up a large part of those rooms, and those rooms are too small. The training room is too small, as I've already mentioned. We have to move our Board of Health meetings over 3 doors down, and we can't do any staff trainings there at all. Matter of fact, everybody's having to do everything virtually on the computer. Waiting room is too small for social distancing, as we previously mentioned. And there is no awning, as I've described with the tent work that we did, to cover the nurses during an outdoor vaccine clinic, such as flu or for COVID-19. And there is no infectious disease area or infectious disease exam area in the health department. That is one thing that we're trying to address in all of our buildings. However, it takes control airflow to have an infectious disease room, so that if you have a person with a communicable disease, such as TB or other types of things, that patient can be isolated, and then there is less risk for that person to providing contagions to other patients. Another area of concern is that the WIC areas are not separated from the clinical area. You go in when you go into for treatment as a patient. The exam rooms are on the same side as the WIC nutritionist rooms, and it does not allow to separate well children from sick children, and that is a priority for a medical clinic as well. So that's just to talk about a few of the disadvantages of the existing facility. I can't tell you why it was built that way, but it's 6,400 square feet with a number of offices and storage space, and it's it's very tight for a medical clinic. So it makes it difficult for the number of nurses that you have to be able to see patients on a rotating basis, and it makes it difficult for the flow of patients because patients are crossing paths, going up and down those hallways, going to the same corner of the building for treatment. So what are we here to propose? As I've discussed with Jason and with you guys in the past, and the Board of Health has asked that we come before you to ask, we would encourage you to consider the new pot of funding from the Georgia Department of Community Affairs, the COVID-19 the CDBG CV grant, which is up to $1 million, unlike the standard CDBG of $750,000. And I'd welcome Mr. Borky to come up here and help explain any question or answer any questions that you may have about the particular grant award. It does not impact any other CDBG applications that you may have in process or in the middle or that you may not have completed. This is completely separate, and it does not, you do not have to have a sit-out period on this particular grant. So if you are awarded this, doesn't mean you have to sit out 2 years for another opportunity. And like I said, it's up to $1 million. Application deadline is December 10th. Building a new facility is an ideal project for this, or renovating an existing location. We would like to see whatever comes out of this have some type of outdoor drive-through capability with the space in that drive-through, an outdoor vaccine storage room, so that the nurses do not have to haul everything out into the parking lot every day in the weather. We would also like to see added at least one of the exam rooms converted into an infectious disease room with control HVAC system, and a much more efficient layout so that patient flow is improved and we don't have sick patients crossing well patients in the middle of the hallways. We would like to improve our vaccine storage capabilities. You guys have some very expensive vaccines stored at our health department at any given time. Usually at Jones County, on a given day, it could be upwards of $30,000 to $50,000 worth of vaccines, for which you and your insurance are liable for. So we prefer to protect that investment. The state is always not gracious in replacing that without compensation. So many of those are state supplied vaccines that we would have to otherwise pay for, and so and then often there are vaccines that we do have to pay for, such as flu. We would also like to improve the training area so that we can accommodate staff trainings, Board of Health meetings, and also meetings of some of our community partners and other providers. That would go a long way toward being able to improve community involvement. I'm not sure how many of you are aware that we already have, Sherry and her team out there already have a unique partnership in that they're doing telemedicine or telehealth with the veterans, the Department of Veterans Affairs with Veterans Hospital in Dublin. So a veteran is able to come into our health department, sit down, go to a computer, and then talk directly with their physician in Dublin or at another facility, and get prescriptions and avoid having to make that trip to Dublin every time they need to get a new prescription filled. So that's been helpful, and that's just one unique partnership that we have. So, what are the next steps? Of course, you guys would need to agree to move forward with the CDBG CV application, and that's why I've asked Greg to be here, and place a contact with him, procure an architect, and as I mentioned, the deadline is December 10th. How do we pay for it? Well, we got the $1 million in CDBG funds. Of course, the county match will be, I believe there's a 10% match, Greg?
That's correct. 10% of total project cost.
Yeah, 10% of total project cost. So if you got say $1.5 million project, then that's going to be $150,000. But the county might match, they have determined, can come from your ARPA funds. So that's a possibility. The Board of Health, of course, has also agreed to put up some matching funds as well. So, and I think they would welcome the opportunity to do that. The other items that we have been successful in other projects, I've been working on about 7 building projects within our district. Baldwin County recently completed their brand-new building, 13,000 square feet. We wrote a $250,000 WIC infrastructure grant for that, and were successful and were awarded. Bibb County recently got around $400,000 in WIC funds, and Jasper got about 70. Monroe is getting about 150,000 in USDA WIC dollars. So we've been successful in all of those ventures, and would look forward to writing a WIC infrastructure grant here. It's based on the square footage of the building, the amount of actual WIC usage it gets, and whether it be common area or dedicated. And so I'm estimating somewhere between 150 and 200,000 could come from WIC on that, to help pay for their share of the cost. So the other piece that's out there that WIC, that Greg just sent us the other day, and you might want to talk about this yourself, is the USDA emergency funds that have come available in the last few days.
Yeah, I'll very briefly touch on that, which is that USDA, through their allocation that came out of the ARP funding, has set aside dollars that can go towards rural health care. And, the guidance on that is still sort of, coming out and making sure that we can read that and process all of it. It's certainly another opportunity. Admittedly, I think USDA is a little bit more of a drawback compared to CDBG, because the match amounts can sometimes be a little bit higher of what's required, and the time process that it takes to go through a USDA review is typically a little bit longer. So those are drawbacks, but those are also options that are out there as well, where you can look at USDA funding. In terms of the match element that Morris mentioned, the 10% of total project cost would have to come from some sort of local funding, either county match or Board of Health funds here locally. So the WIC dollars would not count towards your match. But we would feel fairly confident that we could put together a strong and competitive application if you decide to move forward. And for reference, Monroe County being one of the more comparable ones, I think, to Jones County that we've worked on recently, they had the Board of Health and County Board of Commissioners split the cost of that match 50-50. They both put in about $75,000. I would expect that this one might need to be a little bit more than that, just because construction costs are going up in general. But there's definitely the potential for the county and Board of Health to work as partners in that process as well. So this is a unique opportunity for CDBG funding, particularly because we are dealing with a larger amount than normal. Comes with a slightly larger match than normal as well, too. But it is a dedicated round specifically for health departments and food pantries. So that is the recap of why we're here, and wanted to present this opportunity to you for any consideration or questions you may have.
Quick question, Greg. The matches for CDBG and emergency funds, or just CDBG? We talking 2 matches on 2 different funds, or just the funds for the CDBG?
You would probably take one or the other as your route. I think it's probably the fair.
You're talking about the USDA?
Yeah, the USDA.
USDA, that would be 65% because they would qualify because of population.
Yeah. So
you'd be talking about a substantial match on the USDA funding, and I don't think you can use the CDBG. Well, you can't use the CDBG as a match.
yeah, practically it's an option, but it's probably not your best option.
So you're not talking about going out to both, you're just looking at one or the other?
Yeah, one or the other would be.
Yeah,
more.
the reason I listed these was these are just choices, but the CDBG is, like you said, the most practical.
So what square footage are you looking at, do you envision?
That was my question.
7,000 square feet.
Okay. Monroe just did 3 13,000, I think you
No,
said.
Baldwin.
Baldwin did
Baldwin did
13.
13,000 for 2.45. You know, but honestly, we just opened up bids on another county the other day, and I was told by a contractor to expect on new construction a minimum of $200 a square foot,
Oh, you're right on the money, that's what I was gonna say.
but I'm thinking more like 225.
I mean, 200 would be a realistic number. If
Yeah.
it keeps getting stupid, you go up to 225 to 250.
Yeah. But most of our projects have been value engineered substantially. We're not putting any Cadillacs in any of these health departments, but they're turning out very well. And we've added substantial life and substantial efficiency to a lot of our counties that way. It's a nervous time to go into construction, I know, because of building materials, but, you know, we're not gonna see this opportunity, I don't think, again, with the CDBG, name. So,
Commissioner Martin?
So my brain is solution oriented. Now as we sit here and talk, and I thought back to the budget and how we need to incorporate some of these things into what we do going forward. And so, hear me out, and I'm not speaking for these guys, I'm just talking out loud. So hypothetically, if we moved out of this facility into the courthouse, adding the floor to it for just us and co-locating, maybe it costs us $1 million, $1.2 million. We vacate this space, which is about 27,000 square feet. Health department, it's more than enough for you. That $1 million could be for upgrades of this facility. The vacated health department space then could be shifted to, let's say, 4-H, because they need a home, right? It solves a bunch of issues that we currently have, not only with space and commingling of areas with children and adults, and facilitates our election just a little bit better. In this building right now, we pay for a sheriff out front and utilities. At a courthouse, literally, that's included. And our service debt on $1 million is about $40,000 a year, which is a sheriff sitting out front. So that's how my brain is working, just throwing those ideas out there. I don't know the timing of all this and how fast this can happen, but it just seems like a quick solution, because literally to pay $1 million just to add 600 square feet seems kind of silly, but I know it makes sense for what you need it to do, because the space is probably obsolete. But those are just some things that came to mind as we're sitting here talking. Of course, we need some serious work sessions to really talk about it, but I think those become more practical solutions, because you get 27,000 square feet for about $1 million with renovations. Just talking out loud.
Go ahead.
Well, I want to address that point, you know, renovations on 27,000 square feet is going to run a lot more than $1 million.
They're only
But you don't
talking
need that.
7,000.
Yeah, you're not going to renovate the whole
No, we
27.
wouldn't need that much.
Yeah, you renovate only the space you need.
Yeah.
So that $1 million still gets maximized
Exactly.
as opposed to building from the ground up.
Before, I will throw this out, Jason and I talked yesterday, because of the location of the existing health department to the courthouse, I believe you guys have a meeting with planners that are talking about the courts offices and that kind of thing. And I don't know if that's an option to do some kind of refurbishing of the existing health department to accommodate the offices that you needed for the courthouse, or I just kind of throwing that out there because it was mentioned in the mix.
Mr. Wood, you got,
We'll let Morris finish as far as I was.
I didn't know if you had
I
any
was just
kind of
thinking, well, I do. In 1990, we built 6,400 square feet, and here we are 31 years later. 600 square feet, I think we might outgrow the 7,000 before it's finished construction. And 1.34 acres is a small footprint to put that kind of facility on. How many acres are you looking to relocate possibly to?
I've been looking at property, so, you know, there's several pieces available in town, but Jason also mentioned that you guys may be aware of some county property that I'm not aware of, or that he's not, I don't know. You know, I've got a price on about 3.5 acres for $175,000 out on Bill Cone Parkway, which is adjoining the Head Start Center, or thereabouts. There's actually two pieces there. There's one for 3.5 acres. There's one for 4.25. The cleared 4.25 is, I think he's asking $275. And the uncleared 3.25 is about $175. But he did say he was ready to sell, so it was negotiable.
I got a call from Commissioner Kitchens. You had a question or comment?
I think it was, well, yeah, just, I see where Commissioner Wood's going with it about, you know, growth and planning out for the future and all, but, you know, in all honesty, you know, health departments they don't grow like businesses. I mean, we still got the same 28,000 people in our community, and we're still serving the same number of people. In my world, a 1990 building is not that old, because I mean, when you start talking about renovating a 120-year-old courthouse and a lot of historic buildings, so and it goes right back to Commissioner Martin's. You know, 600 square foot is not a lot to build a new building for. I think you could accomplish what you're looking for with renovating the space that we got for a lot less. One question though, do when we start talking about new buildings, is there a template that we're using for health departments in different communities, or does the staff in each community get involved and say, here's what we need for our community?
The staff gets involved with the architect. The architect has to drive this, you know, of course, to come in and do the needs assessment with the staff, and generally we sit down with the architect and plan out what their particular needs are. But you know, but granted, yes, there are some things that we ask to be included in every modern facility now, which are associated with HIPAA requirements and things like no carpet, solid floor surfaces, that kind of thing. To address your question on space, yes, the space is only 600 additional square feet. And of course, we would love to do more, but we know we probably cannot afford to do more. But if it's designed properly and laid out properly, it will work a lot better than the existing space. I'm not sure about renovations versus new construction. On the one end, I've had contractors in that meeting the other day who said renovations are going to cost you more right now in this environment than new construction. So if we went into that space, I would probably envision at least gutting the left-hand side of the building, because that's where our bottlenecks occur, on that side over there.
That's a brick structure though, right?
Yeah, it's all brick.
Yeah. So you can get it down to the walls and still use your shell infrastructure.
But again, it's located in a spot that people cannot find and get to. And so we're experiencing stagnation and growth there because of that location.
If I can actually add one brief point on that as well too. You know, the process of working with the architect will give us a lot of options that we can look at. So we don't necessarily need a decision tonight on, you know, what exactly the scope of work is. What we would want a decision on is, should we start talking to an architect or not? Because it takes 30 days to get an architect, and with a deadline of December 10th, you know, and they told us about this opportunity on August 3rd, so the state isn't giving us a whole lot of time to work with it, but that would be the more pressing decision is, should we start talking to an architect? You know, and most architects will do the preliminary architectural report free of charge as long as you go forward with submitting a grant for something. And even if you don't decide, you're probably looking at a few thousand for that PAR work, rather than being on the hook for a full project.
So we got to have the architect before we apply for the grant?
Mhm.
Yes.
That's correct.
And we're talking about an architect that'll give an option of renovation versus new construction.
Martin, you have one other thing you want to say?
Oh, no, I'm good.
Okay.
If we did remodel the building, how would your operation change? Because if, it sounds like there's a logistical bottleneck in your building and it needs to be gutted.
Yes.
Would you have to relocate to a,
Yes, we would have to have a temporary facility.
okay,
We're going through that in a number of counties right now.
that's what I was thinking.
You know, so whether we have to actually rent a, retired medical office or something, but we would have to find a temporary facility for the time being, for about 6 to 9 months if it was a renovation, or 6 to 8 months if it's a renovation, probably a year if it's gonna be a new build.
Mr. Moore, want to do?
I don't have a problem with the architect. I mean, if we're looking at renovation and new construction, because I do agree that the CDBG funds, I mean, that's a good opportunity to get money to get what we need, especially if we got a Board of Health. I think Chairman sits on that board, so we can squeeze them every dime we can. So
And I'm gonna make a statement. It's seen, in 5 years, I think I've seen that, the fund balance in that Board of Health go up and up and up. So I think the match could be quite substantial compared to what, I don't think, what I'm trying to say is I don't think the county would have to come up with a match because their fund balance seems to climb every year. So, I don't think the matching part's gonna be any problem or overages at that point for that matter. So, and I see somebody smiling behind his face mask, but, I think they're good on the fund balance on their side, so I need a motion.
motion to go forward with the architect for design services.
Second.
Second, any more discussion?
Mr. Chairman, I would ask that they consider this facility as a renovation option with the architect.
That said, all in favor, aye?
Aye.
Aye.
Ayes have it, thank y'all.
Thank you.
Thank you.
All right, let's move on. Ms. Crutchfield, you have a resolution for Adopt County financial policies for us tonight? You've been patiently waiting back there.
Chairman, I'd like to make a comment that I read these financial policies from beginning to end today.
And I'm gonna get up before the things start
I'm
flying.
not kidding you, I did. I sure did.
Oh,
You didn't, did you?
No,
It was tough, but I did it.
it's no way possible.
you advise everything look good to you?
It looks good to me.
All right, great.
We are doing what this
policy.
policy says we're supposed to be doing.
We should have been doing it.
You're doing a great
Not
job.
what they're doing, what this policy is doing. I don't know what we are.
First of all, I want to say good afternoon, and I just want to read over our resolution. We have two resolutions tonight, our operating resolution and our resolution to adopt our county financial policies. It was a recommendation back in February 2021 by our auditors, Martin and Jenkins, and we have finally come to the end of that road. The finance department, our team, has come together with the Jones County financial policies. So as we go into our new audit at the end of the year and the beginning of the new year, we will have definitely Jones County financial policies. I would like to read the resolution and have this adopted by our board. Resolution regarding the adoption of county financial policies. Whereas the Jones County Board of Commissioners desires to maintain its strong financial position, and whereas the adoption of the financial policies will memorialize many of the practices currently engaged in by the county staff, and whereas good financial policies will only serve to improve the county's operations and finances. Now, therefore, be it resolved by the Board of Commissioners that the attached financial policies that you all have are hereby adopted.
Motion to adopt, Chairman.
Second.
Second. Oh, any discussion? All in favor, aye?
Aye.
Have it. Have an additional
We have an
resolution?
additional resolution, the 2022 operating resolution, Georgia Jones County. Whereas Jones County Board of Commissioners has not yet enacted a budget for the year 2022, and whereas continued operations of the county require that payments for 2022 accounts be made. Now therefore be it resolved that pending the adoption by Jones County Board of Commissioners of a 2022 budget, that the 2021 budget figures for each department's operation shall constitute an interim spending authorization, except that no capital purchases shall be made. Upon the adoption of the 2022 budget, the county fiscal officer shall be authorized to make the necessary adjustments to such budget to reflect the interim operations.
I hear a motion.
Motion to approve the resolution, Chairman.
Second.
Second. Y'all doing good.
Thank you.
Any discussion? All in favor, aye? Aye. Ayes have it.
Thank you.
Thank you, Ms. Crutchfield. All right, number 3, water tower land purchase. Board instructed me to contact a young lady about some land that she currently owns, about their possible purchase. After several conversations and a little negotiation, she's offered the property to us for $37,000. Now, this property was originally appraised, and just for transparency, it was appraised for $30,000. It's on our tax digest for $32,500, I believe, 3.85 acres, I think. But our alternative location would cost us about, Tim, am I right, $400,000 more. So justifying the value of this property purchase for more than our tax digest and appraised value, more than offsets the $400,000 our second location would represent. We need to disclose the legal identification on the purchase, or just to go with?
That, like an address, yeah.
How we paying for it? Where'd the lady go? How are we paying for this, lady? Water fund? Jason?
So I think this would be. Yeah, new construction.
See, she knew. Hey, can you pull us up a legal description for somebody to give a motion for?
So this parcel J45.
You're right.
J4500372.
Mr. Chairman, I move that we purchase the water tower land at parcel J4500372 for $37,000. Paid from the water new construction fund account.
Second.
Second. Any more discussion? None, all in favor, aye?
Aye.
Ayes have it. Thank you. Mr. Goins, position at Highway 49 Gym.
Yes, sir. Good evening, Chairman, Commissioners.
Evening.
We talked the last meeting about the young lady, Ms. Greta Woods, who's currently working at Howie Matty Wells Community Gym as summer help, and I've asked to move her forward and to continue to go due to the new floor and the maintenance that's required on it to keep it like it is, and to potentially be able to open the gym 7 days a week. Now, that Ms. Greta is the one there now, but this would obviously go with if she left to whoever we hire in her place. So the numbers fall like this. That position pay is part-time position. That position pays $12.97 an hour. Should be working 15 hours a week for sanitation reasons, and that would be $194 a week, which is $778.20 for the month. 194.55, which is $787.20 for the month. If we decided to have her work on Saturdays, so that the gym could, because we have a person that works Monday through Friday and Sunday. She came in on Saturdays, would allow the gym to be open 7 days a week. That would be 6 hours on Saturday. That would be $77.82 for that Saturday, 4 Saturdays a month comes to $311.28 for a total monthly salary of $1,089.48 for that position, who would currently be filled by Ms. Greta Wood.
Any questions for Matt?
$1,089, what now?
And 48 cents.
That's for the summer?
That would be total if we had to work on Saturdays also.
What was the first,
The first number of $778.20 is Monday through Friday just for sanitation reasons in the gym.
so when we open the gym, the person's there now is just opening the gym and making sure?
Well, it's not being opened anymore at this point. Because summer's over, so now you're talking about Levon?
Yeah.
Oh, yes. Levon comes in and he opens the gym at 4 o'clock. As soon as he opens the gym, they start playing. He doesn't do any cleaning, because as soon as he opens the door, they're in and they're playing from 4 to 9.
So when they leave, he just?
He don't have enough hours. His hours of operation runs him to 29 hours a week, and he's not allowed to go over to 29 hours a week.
So would she come in before?
She would come in, she's the bus driver for the school system. As soon as she finishes her morning route, she comes over there and she cleans the gym, the floor and the restrooms. And then she does whatever she does, so she goes and picks up kids in the afternoons. And then she would do that, and then she would come back and work Saturdays if y'all decide. So I don't know if y'all need to vote on this separate or however y'all want to do it together. But I brought 2 different numbers so that you can see what the sanitation cost would be versus the work in the gym on Saturdays cost.
And the additional hours for the gym on Saturdays, $311 for the whole month, correct?
Yes, sir.
Okay. Mr. Chairman, I would move that we authorize the part-time pay of $1,089.48 monthly, right, for the position, for the cleaning purposes and to open the gym on Saturdays.
We have a motion, we have a second.
And
Oh, go ahead.
that position currently is being paid $12.97. So I don't know if you need to redo it.
$12.97.
It's $12.97, but if y'all, the reason I stopped him, if you do 189.48, if y'all decide to do any merit raises or cost of living raises, that would freeze this position. So I don't know if you want to do it based on current pay and whatever comes in the future for 21 hours a week. However, it needs to be worded.
You want to amend your motion?
I will clear it up before it gets seconded. All right, retract the previous motion. Mr. Chairman, I move that we authorize the part-time position to include the sanitation and the Saturday hours at a rate of $12.96 per hour.
97.
Oh, sorry, I missed the penny, 97.
So are our other part-time sanitation workers making $12.97 an hour?
They're making wherever they were set when y'all did the salary adjustments.
Again, are those part-time sanitation workers making $12.97 an hour?
I'd have to go back and look, but she's not,
She's
not a true sanitation worker.
Right.
Because her summer job is to come in and open the gym.
And then she'll be opening the gym on Saturday.
That's what she makes right now, as when she comes in to open the gym.
So on Saturday, she'd be working as an out-of-school type employee, which is a school which is categorized as out-of-school employee, where she actually runs the gym, not as a sanitation worker, but as a out-of-school worker / security / student monitor or child monitor.
Now I'm getting more confused.
So we can do this right.
Yeah.
I need a second for.
I'll second for discussion.
Okay, there we go. Now we're doing it right. I don't want this lady over here.
So
backhanding me.
she worked the summer as a gym
Attendant, monitor.
monitor, but as a out-of-school program. All right, and we're extending her. And that's what she's currently getting paid, $12.97. So I don't know, and so on Saturday, she'll still be doing what she was doing through the summer. But Monday through Friday, she'll be doing a sanitation job. I don't know how you balance the two, if you change her salary, where she gets paid one thing Monday through Friday, gets paid something different on Saturday. That would be a Shannon question.
No, the out-of-school worker the Board of Education don't have anything to do with that. I'm talking about
Right.
our part-time salary. Let me just say I support 100% having somebody there, and I support opening the gym because I think that needs to happen. I just want to make sure that we're still following the salary study that we just finished. And if we bring somebody in that has 6 titles and they're not on our salary study chart there with the salary that says $12.97 beside it, we're doing exactly the opposite of what we voted to do with the salary study. So I would,
I think she was still in our payroll, no.
So Levon is classified as a,
Gym security.
Yeah, gym security.
and for the majority of her hours, if you look at summer, which is more hours than she would be doing sanitation, would it make sense to make her gym security?
I'm fine with it.
She
I mean,
reports to
I
you,
don't-
I'm just
titles
asking.
don't mean a whole lot, but so, I mean,
And does gym security start at $12.96?
I don't know. I'd have to look.
I would say that we figure out the job duties and the job title.
And come back with a,
we paid her,
Table it.
the $12.97 come from, that's what she made this summer, when she was employed with us this summer. That's her current pay for the last 2.5 months. That's where that number come from.
So where did we get that? If she doesn't have a job title,
Because we have employees that carry that title already.
It did go through the salary study. That job did go through the salary study,
as,
like gym security, as a gym worker, not as sanitation or anything like that.
so her title is gym worker.
It's like gym security.
So we need to work on that title,
Yeah, because
do,
Gym attendant.
we need
gym
to,
attendant.
do we need to table it, give HR an opportunity to come back with a,
yeah, because I don't want to get out of whack on our and do we have time to table to the next one, or do we need to? Okay, or I was going to say we could vote on it pending the
Well, I think
job title and
The last meeting or 2 meetings ago, y'all approved to have her continue on until we're able to get this rectified.
Okay. Well, then she can continue on until we get
I
rectified,
need you to withdraw your motion and second.
or let it die from
He's second already, so,
I need you to withdraw your motion,
so you want to rescind?
rescind your motion,
I'll second.
rescind your second, and I need a motion to table till the next meeting.
If we rescind the motion, do we need to table? If we rescind it?
Yeah, because
It's
it's
no
on
longer-
the agenda.
Postpone, we're not
Postpone,
tabling.
excuse me, postpone, I get,
Motion to
she
table
uses different, English, I do, we're gonna postpone it.
to
Just rescind your motion and we'll
first
postpone to the next
meeting
meeting.
in September.
I rescind my previous motion.
I'll second that.
All right, now, I need you
You want a motion to postpone
Postpone.
to the next meeting or the, all right, postpone to the next meeting.
Second.
to, second, all in favor, aye? Y'all get it confused again? Thank you, Matt.
Quick question while we're looking at that. Do we need to look into Levon's title? Also-
Yes.
Gym attendant, that would cover all of their duties.
Just,
Attendant.
Clean it up a bit.
see what you got.
And-
Because in all honesty, we opened a gym knowing that was the intent, and we didn't have any gyms that we were attending before when we started doing these salary studies, so
The
I do
person
think we
can
need
attend
to.
to anything that needs to be done there.
All right, man, you got the golf course next.
Yes, sir. So last year, we had an issue where some adjacent property, I don't know if Mr. Jason can pull it up real fast, is a hunting club. And we had an issue where they are, from time to time, venturing with their side-by-side utility carts or four-wheelers onto the edge of the property of the golf course. And there's no clear defined property line back there. And we've been looking at it. And so this being the golf course, all this back here is a hunting club, and there's no defined property line. And right in through here They're venturing out because it's obviously easier for them to move through the hunting club out here than within here. And we talked to the hunting club last year during hunting season, and they were willing to try to work with us a little bit. We got through the season, nobody got hurt. We've been trying to get it surveyed ever since, and getting someone there is nobody want. I shouldn't say nobody wants to. Can't get anybody to come out for various reasons. Donaldson and Garrett out of Macon is a company or a firm that we finally got willing to come and try to do it. They've already been doing some preliminary homework, and they can't find any deeds at the courthouse. They can't find any firm, anything that says where a property line would be if it's there.
There's no meets and bounds description.
No, they can't find anything. Me and Mr. Jason talked to them on the phone, and so we asked about, and they've said they could come out and they could try. The reason I'm here tonight asking is we've done some homework ourselves, still can't find anything. I talked to Max Davis multiple times, and he don't know of anything either through his experience. So Donaldson and Garrett is the only people willing to come to try to do our boundary on the back side. The reason I'm having to ask this question is because they could not and would not give us a firm number. They said it could take 2 hours, 2 days, 2 months to try to find where those pins should be, where they're confident enough to give us that information to say, here's where your property line is. That could run anywhere from $2,000 to $8,000, and that's with that range is why I'm here tonight bringing this to your attention.
Quick question, you try Ogletree and Chivers, because they do primarily
Try who?
Ogletree and Chivers, and
We've contacted every survey, and even Max has tried to, Mr.
Yeah.
Davis has even tried to help us get
that's
people.
all. Jones County is their main county for surveying. It surprises me that, I mean, there's gotta be a firm plat on one of these. Either the hunt club's got a firm plat to go by that we can find the corners on, or the,
Yeah, it's going to be based off the surrounding landowners, and it may have never been surveyed for all time's sake, and it may just be time to do a survey on the golf course and figure out exactly what you have. That way it's
And
settled.
unless I'm saying something wrong, am I accurate?
Yeah.
might lose a fairway. I've seen it before. Be ready.
But this is, the reason that this is we got
Play
golfers.
17 holes.
We actually have number
Right,
5
right,
fairway.
28.
Number 5 fairway is really where the safety issue comes in, because that's where they actually venture out of the woods onto, they're not actually in the turf, but they're right on the edge. And so as they're maneuvering down the side of number 5 fairway and golfers are playing, there is risk that they could get hit with a golf ball. Now, who's at fault when that happens?
I'm more worried
Trespassing
about
signs, but-
deer season and guns and not being able to post our property versus, you know.
Well, and that's we went down that and we said, well, you're on our property, and they said, prove it. And I can't prove it.
I know.
Huh?
So just out of curiosity, for those who have been in Jones County for forever, how did we get the golf course? Who originally owned it?
It was a works.
Started off in the 30s through
Yeah.
a federal grant back in the 30s.
It was a WPA project.
So it's in the
New-
basement of the
new deal.
courthouse somewhere in a box, if they can find it.
Doesn't Mr. Adams own a lot of property around it?
He owns, Mr. Adams owns some property
On the other side.
on the end going toward Baldwin County.
Somewhere there's a plat. It might be downstairs, but there's a plat that.
I like the idea of using the adjacent properties if we can't go back and find it in a box in the basement of the courthouse. Or good old fashioned, who's been maintaining it for the last 20 years, right?
Matt
It's
and I looked
ours.
at it back in January, and its property line was not marked, and it's anybody's guess of where it is out there until it's professionally figured out.
Commissioner Martin, you got a smiley face. What do you want to do?
Hey, I'm prescriptive at this point, as our attorney says. We've been maintaining it, it's ours. Put a fence up. Sorry. Challenge it.
I'll do whatever you want me to put a fence up, I'll put it up.
What the board want to do?
Is it cheaper to get the survey than it is to put a fence?
Yes, it's cheaper to get the survey.
I mean, I'm not literally worried about anybody getting hit by a golf cart, but I am, shooting is a bigger issue. But literally, they should not legally be allowed to shoot in the direction of the golf course.
You have the other liability of people coming off the hunting club. Let's just say somebody breaches their gate, gets on there, they can ride all over the golf course, tear it up.
I agree with you. Put the fence up. No, I don't know what a survey costs at this point, because to your point, it's hard to get somebody to come out on basic stuff, and that's huge.
He gave us the ballpark 2 to 8. That's why I'm asking, because when we had him on the phone in Mr. Jason's office, he said we could get lucky and find some pins somebody put in years ago, and we could find it in 2 days, or it could take 2 months. Now, we don't know how long we're gonna have to be in those woods.
Ballpark of how much?
2 to 8.
What's the board want to do?
I don't think it'd be, because what he's gonna do is get some measurements on the adjoining properties as close as he can. He's gonna get within a 50-foot area or 100-foot area and start,
There's too many
looking
smaller,
for a pin.
he gonna get a reference off one of the smaller tracks coming down the gray side.
And then when he gets that, he's
He's gonna
game
come
on.
out here and mark a corner based on the footage and go from there.
Yeah, he was saying that he wanted to make sure he could find enough data that he gave us something that we could legally stand on.
So just to be clear, after the survey, we're still putting the fence up.
They're putting posted signs up, and they might have to
Okay,
get their attention that way.
all right.
When you find a line, you can go in there and make you a lane right down the property line.
Okay.
That would be for that landowner too, so they can access the other parts of their property without going onto the golf.
Gotcha.
Just
Being
fire
clear.
break, we won't have any reason to come over there.
Okay.
And Matt can build a fence a little bit at a time.
We don't need no fence, we just need to know where we're at, so we
If it's far enough in the woods, we can do some old-fashioned barbed wire.
we can be here all night, or I can get a motion from y'all, picking at y'all.
Make a motion to move forward with the survey with a not-to-exceed amount, Chairman.
Do we have a second?
Second.
Any discussion? All in favor, aye?
Aye.
Have it, thank you.
What was the not to exceed?
You did.
Okay.
Right. You still here, wine license?
Yes, sir. So, pass these out real quick. We currently carry a beer license. We do not carry a beer wine license. And we're trying to grow our ladies population at the golf course. This, what you're looking at, is one program that we're looking to do to grow.
So it takes wine to get women to golf? Is that how it works?
No, this is a request from them. They said that we sell beer, then we should be able to sell them the little small bottle wines, not the whole bottle, the little small.
You sure? What if they want a big bottle?
Well, we won't carry the big bottle. We'll carry the small singles.
Motion to approve wine license at the golf course.
I'm liking it. I'll second that one all day long.
I don't know about the name.
I
though,
like
Matt.
it.
Sipping tips.
Well, this particular social will be, so explain this social real quick. This is a social where they would pay $20 for one night or $80 for 5 nights, which means they save $20 by doing it all at one time. They come out to the golf course at 6 o'clock. They can have social hour. So it's to grow the women populations. They'll have social hour, then they'll go on a driving range where they'll have Mr. Andy, our honorary pro, and then you'll have me or someone else on the putting green. So they'll get golf tips while they're having sips.
Shannon's all for this, she's gonna start taking golf lessons.
And that's the hopes. The hopes is that happens.
So they can drink wine and play golf.
I just want a T-shirt.
Me and drink beer all the time and play golf.
That's what I'm screaming.
All in favor, aye? Aye. Is that enough discussion?
I can see this is gonna cost me money.
You think your wife would do that too?
Yep.
Who's up next?
I'm sorry, I did say I didn't hear everybody
That's
else,
it,
y'all.
thank you.
They went through the okay.
We're going to old business. Mr. Rizzer, we need to, you don't have enough data yet for this, so.
I'll
certain commissioners and chairmen hadn't answered their questionnaires yet.
Oh, sorry.
Oh, I say we call them out,
Called out one of them, the other one,
as long as it ain't me.
I owned up to it. In fact, I did forget something.
My bad.
I need a motion to postpone this until the next meeting.
Why you want to postpone? I know I didn't do it. Did you guys do it?
I didn't do it
I
yet.
didn't do it.
Terrible.
I did.
We got one then.
We trust
Four did.
Jason. I don't know about Sam.
All right, I need a motion to postpone the next meeting.
Motion to postpone.
Second.
Second, all in favor, aye.
Aye.
All right, department head. Matt, come on.
I do. Have two things, sir. So the first one, we started having a conversation the other day about Employee Appreciation Day, which we always do in conjunction with Veterans Day. This year, Veterans Day is November the 11th, which is a Thursday, which if we do like we always have, that means we would have the lunching on Wednesday, and then it'd be off on Thursday, then come back to work on Friday. So two options. One, we moved the holiday from the 11th to the 12th, so we'd have the lunching on the 11th, and then it'd be off on the 12th. Or it was brought to my attention that we could ask that we still have the lunching on the 11th. You still get you still have the lunching on the 10th. You get the 11th off, and then you throw in the 12th also.
Wait, what? Wait, what? What?
So, Employee Appreciation
Thursday
Day.
and Friday off, what you're saying.
That's just, I was told to ask that option,
And
so.
Wednesday.
Well, Wednesday is, we have the lunching. We always have the Employee Appreciation Lunching the day before Veterans Day.
Right.
So Veterans Day is on November 11th, which is a Thursday. So if we stick, historically, we would have the lunching, which means every county office shuts down at 11 o'clock on Wednesday, come over for lunching, and they get that afternoon off with Veterans Day the 11th. That means you come back to work on Friday. We're asking two options. One, move it to where you get half a day on the 11th when you actually have the lunching, and then you get Friday off, which takes you into the weekend, versus the 11th off, you come back on Friday, then you have the weekend. Does that make sense? It's just pushing it to extend the weekend.
Basically, we got 3 days.
It's just
I would
food.
just
Tonight,
say-
you can't vote on it tonight anyway. It's just food for thought tonight. You can't vote on it anyway.
I would say that this is just one of those deals where there's not a real good way to work it. You know, I mean, and there may be other thoughts that the board has on how to address that. I don't know. There's just with the holiday coming on that day of the week. There's just not a great way to do that.
We'll have to think on that and
Yeah.
figure out how it's gonna work.
I will remind y'all that this year, Christmas and New Year's is gonna be on a Friday and a Saturday. So we're gonna have to put those dates on a weekday, right?
The Thursday and Friday.
Thursday and Friday, and then the following Thursday and Friday, so those are, 2 more days we're gonna have to add to the calendar. Just a thought.
Yep. And then my last thing is, went back and worked on the litter slogan thing contest. We have a QR code, which is active. You hold your phone over it in photo, and it brings it up, takes you to our county website. We got this out to Miss Rackley. She's pushing it to every principal and art teacher in our school system, all the way from K to 12. We posted on all of our social media sites. The chamber posted on theirs. Keep Jones Beautiful. So we're pushing it out as much as we possibly can. I was going to get with Shannon because I don't have access to the main page, so I'll get with you about the main page. And so it is live. It is active. We've already started getting people sending stuff in, ideas and slogans in. So it is out there, and you'll start seeing it in windows of local businesses like banks and hopefully Ace Hardware and Ingles and other places. You'll start seeing it where all you can just walk up, hold your phone over there, and it brings it up and tells you all about how to do it. So that was it. Just wanted to bring those two things up, and
Thank you, man.
thank you.
Mr. Ritter, you got anything? Brody?
Nothing.
Mr. Mayor, what you got for us tonight? Welcome.
So, it's short and sweet. Tomorrow is the official opening of our newest downtown restaurant, Ben Axel. We are getting posted on social media. Some people have an opportunity to go to some of the soft opening dinners. Unfortunately, I had another meeting at that time and wasn't able to attend, but Be open, be closed on Monday and Tuesday right now, so tomorrow's the official grand opening. And come out and visit downtown Gray. Gray is great.
It's great.
Citizen, any citizen like to come forward? None?
I came,
Come on forward, yes, ma'am, come on forward.
well, I just came to.
Can you get real quick for the record, give us your name and
I'm
address?
Carolyn Thomas, I live in Haddock,
Yeah.
and I live at the end of a dirt, dead-end road, and I'm washed out. And it just kind of irritates me to see that there's 5 houses in that, probably a quarter mile, and the one lady will call and complain about the ditches being full, and so they go there and they clean out her ditches beautifully. And we're all down there, and we're all flooded, and they won't come down the road and finish.
We can fix that,
And that happens all the time.
we can fix that.
And can I show you a picture?
What road is it?
Weaver Road in Haddock.
All right.
It's a half-mile long.
What is your address, ma'am?
206, I live at the very end.
206. I'll ride out there tomorrow and look at it.
I've been there 41 years, and I really don't have any complaints about Jones County. I'll tell you, I'm proud to say I live here, but can I show you this picture? This is a tree that must be 200 years old.
Wow.
And that particular limb is where I have to drive under every day. And every time there's a storm, more of it comes down.
Okay. Commissioner Wood will be out there.
Something could be done about that tree. I don't think anybody claims ownership.
Could you give John your phone number also?
Sure. It's 478-932-5412.
You'll get out there tomorrow and take a
Yes,
look
ma'am,
at
I'll
it?
come out
Yeah, and
tomorrow.
see, there's the tree again. And there was a picture somewhere. All
Yes,
the
ma'am.
limbs that have been coming down.
Right, we need to determine if that's on county right of way.
Yeah.
It's definitely a safety hazard. It's,
Hey, we appreciate you coming tonight.
right, thank you.
Thank you.
And I got another request.
Sure. Yep.
I'm going to give it to you all at once. Over the years, I've heard twice, and I don't remember which years, that our road was on the list to be paved, and it's never been anything done. And my understanding was there was a lady that lived on the road that was very much opposed to it. Well, they're gone. And the people that are there are a new young couple. They would love it, you know, and they would be willing to give whatever had to be taken. So, you know, if someone could look into that, maybe, that sure would be pleasing.
John, take a look at it tomorrow, he'll give you a call.
Yes, ma'am.
I sure appreciate it.
Yes, ma'am.
I'll
Thank
call you
you.
when I come out tomorrow.
Thank you very much. Anyone else? Commissioner Wood, you want to start us off tonight?
Yes, sir, Mr. Chairman. For everyone that missed it, we had a very good budget session on Saturday. I look forward to getting the budget passed this year and moving forward and getting things moving in the right direction in this county.
Mr. Kitchen?
Nope, nothing, Sharon.
Wow. How about that? Commissioner Martin? Uh-oh, he got a smirk on his face, no trouble now, he got a list.
No, it's really short. Just like tonight, Board of Health came, and we know that we have some opportunities to fix some things for the betterment of our community. At the end of the day, it's about our citizens. They're why we're here. So let's start really looking at not just that facility, but the other facilities that are 5 and 10 years out. I know, Sam, when you did facilities, y'all looked much longer than that. And leveraging all of the crazy money that's available. How can we not build or renovate something for $100,000 on $1 million? I mean, it doesn't get any better than that. And I just think we need to take the long view approach, whether it's us at this time or the next commission or the commission after that. I think we have a responsibility to put those things in place now. So hopefully we'll look at those things, and future SPLOST will consider that as well for a capital campaign or major capital events, as opposed to just subsidizing budgets. And to John's point, we had a great budget session. It was probably the fastest I've ever seen in the county. And again, I thank Levita and those guys for making this thing very efficient. I don't worry at night about our money. I think we're pretty good. We just have to spend less and invest more. Thank you.
Thank you. Needed some help. I need one more motion tonight. Wendy's not here.
Motion to adjourn, Chairman.
Second?
Second.
I can't say that.
That was a second with a question mark.
Second, what a question, all in favor, aye?
Aye.
Thank you.